Hi, my name is Dr. Quiana Fluellen. I am the owner and founder of Body Goals Physical Therapy and Wellness, and I'm a physical therapist. What has inspired me to become a physical therapist is one, I've been an athlete my entire life. I did track and field as a youth. I went on to Florida State University to do collegiate track and field. So sports and the human body has always been a part of my life. But most importantly, my grandmother growing up, she was a diabetic and she had a lot of complications. She had to undergo bilateral amputations and prosthetic limbs, and she had to learn how to walk again through physical therapy. So I was able to follow her through her journey, and that just encouraged me to go through the career path of a physical therapist. Pretty much, I was so tired of working so many hours and having so many patients at one time at certain companies, and I knew I wanted to slow things down and treat patients one-on-one. So I started Body Goals Physical Therapy and Wellness 8 years ago. We have an outpatient clinic in Roswell, Georgia. We also do home health, physical therapy, and occupational therapy throughout Metro Atlanta. So that what guided me through my background in physical therapy and just wanting to be able to reach more people and reach more hearts. The most rewarding part of my job is to follow my patients through the beginning of their journey and push them through some limitations, help them goal set, and just help them to just build confidence. What I enjoy most about helping people recover is honestly just seeing them go through the process and making it through and seeing the light at the end of the tunnel. So being a physical therapist, we see so many patients go through things, but it's rewarding to see them get past their barriers. I work with a lot of different patients and different populations, but my geriatric population, I've learned that family is everything, and to live life in the moment and do not take things for granted. A lot of times families think that sitting and resting is the best form of health or for patients to get better, but honestly moving through some things is the best thing. So we try to teach families limited mobility, but to push patients through their threshold, and that's where physical therapy is really important. Because different targeted areas can limit mobility. So therefore, physical therapy, let's say someone's having chronic lower back pain, you can't just say get up and walk. A family could say, hey mom, get out of the chair. But we help the patient with the targeted areas to be able to walk again, to be able to stand again, because a lot of them are limited in the walking, in the moving, but the mobility starts in a chair, starts in the bed, and then we build on. So that's where it gets a little complicated. If someone's having trouble getting up, so we have a sit to stand test, and if you cannot sit to stand without the use of your hands, then that's a big indicator that you're a fall risk. You have them cross their arms across their chest, you ask them to stand up, and they're unable to, that's a high fall risk. If they have to use their hands and rock a lot, then they're indicator of a high fall risk and that they need to strengthen their lower extremity and therefore possibly need some physical therapy. The biggest misconception is that you need to be injured, you have to have surgery to seek physical therapy. A lot of our clientele, especially in the homes, a lot of our clientele is maintenance. So we see patients throughout their life, especially our 55 and older. They're not in pain, they didn't just have surgery, but we're helping them to gain and maintain their mobility. So the misconception is you have to be in pain to seek physical therapy. The biggest mistake is not moving at all, like I stated before, just being stagnant, and that's how you become sedentary, that's how you can increase the risk of blood clots, and that's how you could be chair or wheelchair bound or homebound.
So do you approach recovery differently for someone recovering from surgery versus someone recovering from like a neurological condition like a stroke?
I approach everyone, I says at Body Goals, everyone is an athlete, so everyone is approached by me and my team the same way. However, it's customized and there's different goals. If someone has a neurological issue, we have goals for that. If they have an orthopedic issue, we have goals for that. But as far as the difference, there's not much of a difference as far as our philosophy. at age 0. No, just protect your mobility at any age, from a youth athlete to a 90-year-old patient. Your mobility is everything. We need our bodies every day, so there's not an age limit. I'm looking for fall risk items. So the CDC has a fall risk checklist on their website. However, at Body Goals, we do home assessments. I'm looking for throw rugs, cords, oxygen tank cords. I'm looking for pets. I'm looking for equipment, or your stairwell, if it's shaky. Is your stairs shaky? Is your chair sturdy? It's a lot. Do you have clutter? Do you have handrails? So there's a lot that we look for. So that's the bulk of our home assessments. The biggest advantage is we don't get many cancellations. We come right to you. Another biggest advantage, we're able to adapt your home. So I have a lot of patients where we think of different barriers or compensations. So if someone's having trouble getting up from a low chair, we may suggest getting a higher chair, changing a surface. If you're having trouble getting in and out of bed, so we're able to visually see what's going on versus hearing it. So a lot of the families love that second opinion and the assurance that their family members are safe. Recovery at home, just because it's at home, it does take time, and it's okay. And also, I would like families to know there are clinics, because some patients need to be pushed outside of their home. So we do grandfather a lot of our patients into an outpatient setting, especially to reintroduce them into the community, because that's good for their mental health, for their independence, and for their quality of life. One, physical therapy or occupational therapy. In all seriousness, we help family and caregiver education. We're the middle person. We're able to give home exercise programs and able to have the family member step to the side for the patient to be a little more independent. So therefore, we help with independence, and then also help with the family member's trust in the actual client. Signs that a person may need additional support are declined health. That could be failure to want to eat, drink. If you feel like they're holding furniture or walls to mobilize themselves around the home. Multiple attempts to get in and out of a chair. Their fear of leaving their home or driving are signs. But the biggest fall risk at home is clutter. It is also just not having the equipment needed, like a handrail to get it in and out of the shower, or a assistive device like a walker or a cane. Those are some of the things I see, because people are furniture walking or seeking other devices that are not appropriate to move around. The practical tip is to seek a physical therapist, or occupational therapist, because you do want to make sure that equipment is fitted right, properly, and is proper for your loved one, because I would hate for you to give them something and it can also cause a fall because they have to walk properly with a certain device, or you want to make sure it is installed correctly. It's a lot, because I see a lot of patients, but my stroke patients are, it's dear to my heart. My dad had a stroke coming on 3 years from now. So seeing someone going from, paralysis or wheelchair bound, and seeing them take their first steps, seeing them, dress themselves for the first time, that always draws my heartstrings, because you take them from being bed bound or wheelchair bound to being more independent. So my stroke victims have a special place in my heart. That is a very good question. One, walking is just a simple way to stay mobile. I always tell my patients, if they are likes to be at home, you don't have to be homebound. Some people are just homebodies. To try to get up every waking, you do not have to wake up out of your sleep, every 1 or 2 hours, and take a 3 to 5 minute walk around your home. Move your body, because it's not just about your joints, it's about your heart health. So you have to move your body. That does decrease pain, that does help build muscle, and that does keep us here longer here on earth. One habit is stretching in our 30s and 40s. A lot of people think because we're 30 or 40 that we have to wait until we're 50 or 60 or plus to implement stretching. But the more that you stretch now, the less impairments you will have as you get a little older. And I just turned 40, by the way, so I'm definitely stretching every day. I mean, I really wish people knew that we're here to help. It is, I feel like, an underlooked profession, and you don't need it forever, but it's definitely a good supplement to other types of wellness, such as going to a chiropractor or going to a doctor. We are a good addition to your village. So I would love to bring more awareness to the physical therapy world. You can follow me at Body Goals ATL on Instagram and on Facebook, and our website is bodygoalspt.com, and we're here in Metro Atlanta, and I really appreciate you all for having me.